Dr. J. Bhattacharya is the National Institute of Health Director. And I mean, when you work on this MAHA report, Make America Healthy Again, I look at it, you talk about simple things you can do. And I think there's things on a macro level as an individual and as a family, you can change certain things, but there's going to be things that you probably didn't know about. And there's things that you can't change. And that's why you need people like RFK Jr. that know these things and to try to do it for the best. For example, one of the big things we're talking about, these artificial dyes that add nothing to flavor, but have all these other health consequences. Why are we allowing certain things to happen in this country when other countries have outlawed it?
It's going to take a lot. It's not going to be one thing, but that food dyes is a good example, right? So the philosophy in Europe is if you don't know for sure it's safe, you're not really you really shouldn't be giving it to people at scale, right? So why have petroleum-based food dyes if you haven't proven it's safe? In this country, unless it's proven unsafe, you could just give it to people at scale. The government doesn't test those food dyes for health effects extensively. It's just assumed to be safe. There's literally something called a standard called generally recognized as safe. And the FDA then says, okay, if it's generally recognized as safe, well, you can just do it. Is there no requirement that companies that put these dyes in their food prove that it's safe? It's really a question of burden of proof and threshold.